Hi Martin. Tell us a little bit about yourself, a bit about your background.
Well, originally I trained as a remedial gymnast, recreational therapist and then as a physio. During that time realised the importance of biomechanics, which is how the body moves, how it was intended to move, and actually what can go wrong as a consequence of altered biomechanics. So we spent quite a bit of time doing some research to try and understand more about that, and it was quite pioneering 20-25 years ago. And what we've now done is put all that information together so we can train what we call biomechanics coaches. So that's what we spend most of our time doing at the moment.
Okay, and biomechanics coaches, how do they link with the Dynaspine?
Well, I was asked some time ago to look at a new way of developing a back support for chairs and so on. Fundamentally we came up with the concept of the Dynaspine. There was a group of us, physiotherapists, orthotists and prosthetists, to try and design what is the next level of back support.
And what's different about the Dynaspine to other back supports? What makes it special?
Yeah, most back supports are really effective at supporting the spine, putting the spine into a relatively comfortable or neutral position and supporting the spine in that position. But what we've found over the years is with the latest research is that the position is important, but actually it's very important for the spine to move. The body was designed to move. Obviously when we're in pain that's difficult. But if you're supported in the right position and you're allowed and in fact encouraged to move, which is what the Dynaspine does, that's the best form of back support that we've found.
Okay, so who is it suitable for? Is it anybody or?
Yeah, it's anybody that wants to prevent back pain, anybody that wants to try and help to manage it. Of course, if you've got a problem, you should be seeing somebody to try and manage that for you, but as a complement to that. So people who are sitting for most of the day in an office, for example, would be perfect. But even when you're driving a car, when you're travelling on a plane or a train or whatever, so it's ideal for it as well. But also we found it particularly helpful for ladies that are pregnant. Obviously the spine can be quite vulnerable at that time, so we found it can be very helpful for those as well as the elderly. So it really is across the board, it's a broad spectrum that it can benefit.
Fantastic.